You've made this announcement. Jonathan Van Tam has been speaking this morning on people having to maintain social distancing post the first vaccine. So basically, your message is after your first dose, you can't do any more than people who haven't had a jab.
Well, that's right, because of this problem that we don't yet know how much the vaccine reduces your ability to transmit the virus. We do have a high degree of confidence that it reduces your risk from dying or serious disease. But if you think about it, young children hardly have any serious disease from coronavirus, but we know that they still spread it, and we're of course monitoring this. And but it underpins this point that you should, if you've had the vaccine, it's very important that you continue to follow the rules. And this is the fastest way to get out. I was just listening there. I agree with you very strongly about the positive point you were making about the progress since the 80s on gay rights. And HIV was a massive killer pandemic, and we got through science we got control of it. And that was a slower burn pandemic. This pandemic, science is going to defeat. We are going to defeat this, but it takes time. The most important thing is that the vaccine rollout is happening incredibly quickly, and we're managing to get it out and injected as quickly as it can be produced.
We spoke to Dr. Asher Salmon, from the Israeli Health Ministry. That interview is coming up later in the programme. But he said that Israel doesn't regard someone as being vaccinated until 7 days after the second dose. Do we make the same judgment?
Well, our assessment is that it's after 3 weeks that you get the protection from the first dose. And it's because we can see in the data that the first dose gives you protection. That's why we've moved to spacing out the doses this much. And I know that there's a debate about this, but ultimately we think this is the way to save most lives, because given that there is a limit, obviously, on the amount of supply, you want to make sure as many people get that protection from the first dose as possible. And that means having the first dose spaced out from the second, so that we can use all of the early doses we have to protect the most vulnerable.
But do you regard people who have had that first jab as vaccinated? I assume no.
Well, it depends what you mean. I mean, we regard people who have had a first jab more than 3 weeks ago as likely to have a high degree of immunity. But as we've discovered so much in this crisis, these are epidemiology and the vaccines program are a matter of degree, not absolutes. So we have a high degree of confidence that you have a high degree of immunity from serious disease and death, and we know that because the clinical trials have shown that. But it's hard to put that in absolute binaries, vaccinated or not vaccinated. We regard people as having had a vaccine on a certain date, and we think it's highly likely that they will have had protection after a certain period of time. But we're monitoring all of this really carefully, and then we distill it into what we think the public needs to do in as clear a language as we can. Like, it's really simple things, like stay at home unless you have to leave home, and get vaccinated when the NHS calls you. The messages to the public are really clear and simple. The science that underpins those, of course, is complicated, and we're learning more all the time.
How important is it to get that second dose?
Well, it will be very important, and we think that increases your degree of protection, but it's important to get it at the right time. And it's important that as a society, we use the resources that we've got, this massive supply of vaccine, to vaccinate as many people as possible. And hence we're able to, because of the increased supply that we've got compared to most other countries in the world, we've been able to go faster and protect more people. As of this morning, I've just had the figures through. over 3/4 of over 80s have been vaccinated. I mean, that's amazing. Over 3/4 of all the people in the country age over 80 have now been
It is
vaccinated,
amazing.
and
But should we call it
around
vaccination,
three
or should we
quarters of
call it their
care home
first
residents
dose?
too.
Yeah, yeah, it's interesting that because of course they've had the vast majority have just had that first dose. What I'm interested in is, do we have to wait until the whole population has been vaccinated twice fully? Do we need to keep social distancing until then?
I hope not, and for that we need to see the impact of the vaccine on transmission, and those data don't yet we don't yet have them, but we're monitoring very closely, and we should get a readout quite soon.
Okay. You mentioned, and Jonathan Van Tam has written today, that if you've been vaccinated, you can still spread the virus. I don't know if this is an idiot's question or not, but I'm quite interested in it. So, do you have the virus, but you have no symptoms? Or do you literally carry it on you, for example, on your clothes or your skin?
Oh, no, it's closer to the former rather than the latter. In the same way that small children can have essentially a small amount, and because you've been vaccinated, your body can fight it off much more easily, so it doesn't become lodged as the serious disease that we see in a minority of people, but a significant minority, which is the root cause of all of the problems from the pandemic.
Okay, understood. So it's like that you have the virus, but you don't display any symptoms.
And so this is the
vaccination,
the hard thing is you may not even know that you've got it, and that's the challenge.
And so, do we have data? I think you said around 80% of 80-year-olds you expect to be vaccinated, or we're close to getting that vaccination. How big a problem is it if 1 in 5 people are not vaccinated?
Oh, well, that's just as of today. So we do need to have high rates of vaccination, especially amongst older people, because they're so much more likely to die or suffer from serious disease. And so the figures as of this morning are that over 3/4 of the over 80s have now received their vaccination. So that's happened. And so that's great news. I want that rate obviously to keep shooting up, and it's going up at several percentage points each day. So I want that to go really high. Now, I think that it will. The evidence is that a very, very high proportion of people want to get the vaccine. And there was this worry, wasn't there, at the start of the vaccination program, that there'd be a whole load of resistance. Why? We just haven't seen that. That hasn't materialized. I think it's because people understand that this is the way out, and it's the way to protect yourself. So that side of things is going pretty well. We're over 3/4 done, and no sign at all of any lack of enthusiasm from the remainder.
Okay. The 15th of February is the date that we first review these restrictions. Can we assume that nothing's going to change on the 15th of February?
Well, the 15th of February is the date by which we have committed to ensure that everybody in the top 4 categories will be offered a vaccination slot. And that covers people who are who are the most vulnerable. So around 9 out of 10 people who die from the disease are in that group. The challenge is that the decrease in the number of people who die that we'll get from the vaccination program will happen at about twice the rate as the decrease in the impact on hospital capacity. And obviously, younger people are more likely to survive, but they may well spend a long time in hospital. And we know the pressure on the hospitals right now. So this is making sure that we protect not only those who die, but also then those who who have very serious disease and end up in hospital is critical. 15th of February, we're on track for that in terms of the rollout of the vaccine. But as I say, because we don't yet know the impact of that on the ground, we don't know when we'll be able to lift the measures, but I want to lift them carefully, but also as soon as safely possible.
Let's have a look at just a few specifics. Do you believe that anyone, and I know most people cannot travel at the moment, but should anyone coming into the UK have to quarantine in a hotel on arrival?
Well, I think that it is very important that we protect ourselves. I'm not going to go into the specifics, tempting as it is on this Sunday morning. It is because of the new variants that we're more worried about international travel, because of the vaccine programs going so well, and the vaccine works against the virus that is here in the UK, but we do not know whether it works so well against the variants from abroad. So I can't. But in terms of the exact policies, that's obviously, cross-government work, and the Home Secretary's leading on it, and the Prime Minister has shown personal leadership on this, and we're all working together on what we need to do to protect the country.
Okay. What's your assessment of whether local elections can go ahead in May?
Well, I think that we should be able to put in place arrangements, but again, I know that that's something that's kept under review. But there are ways to do this. It is not easy and it's challenging, but I see there's an awful lot of work going on to try to make sure that they can happen. In the same way that we've been able to keep Parliament open all the way through. It's not simple, but keeping Parliament open has been very important.
And we hope that we can continue with our democratic processes in May.
Well, I certainly hope so, and that's the government's intention. And there's a lot of work going on to try to make that happen. But of course, we keep all these things under review.
Matt Hancock, the last time we spoke, a couple of weeks ago, it's nice to speak to you so regularly. You said we'd all have a brilliant summer. I'm interested in what you meant by that.
Well, I think that I've got a high degree of confidence that by then, these restrictions can be being lifted and or lifted entirely. I think that I said I hope we have a great British summer, and I think that this vaccination program is going well. The rollout is going fast. The early signs are that it's working. The number of cases are starting to come down, but there's a long time between now and then. And if we've learned anything in 2020, we've learned that things change. The Prime Minister set out the conditions that we need before we can start to lift the measures, and I just hope that we can. I hope we can get this, this under control. The new variants are a big challenge. Both the new variant here, which obviously has meant that the disease spreads much faster than it did, and there's this increased risk of people dying from the disease that has come to light in the last few days. But the critical thing is to make sure we protect ourselves from a new variant that might not respond as effectively to the vaccine, as in the vaccine might not work on it as effectively. And protecting Britain from that is absolutely critical to making sure that we can get this sorted as quickly as possible. That's why the conversation has changed about the borders, because it's not just about protecting Britain from countries abroad where there's a high degree of spread, not least because there's very high levels of coronavirus here in the UK right now. It's that these new variants can really set us back, and we need to protect ourselves against them coming in.
Mr. Hancock, good morning. It's Tom. We've only a few minutes left, so I'm going to ask you some succinct questions in the hope of cheering us up a bit, a little bit of expectation management on this snowy, misty morning. 478,000 vaccinations a day you hit yesterday. That's an incredible figure. Congratulations on that. Can I ask, is that a sustainable daily rate that we should now expect every day?
Well, it depends on supply. So the delivery of those is sustainable. And, when I hear people on the ground, GPs saying, come on, give us more vaccine, we can get more done, that warms my heart. because although it's normally said in frustration, what it means is we can get more out if we can get more made.
So tell me about the supply.
So it's all about supply.
You'll know about the supply. You'll know how much supply you can expect. Can you expect to get enough supply for 478,000 vaccinations a day?
Well, I hope so, but the reason that I can't be stronger than that is because it's a difficult process. I pay tribute to the manufacturers who are doing an amazing job on this. So I hope so, but it's not like it's not like just making a chemical compound. This is complex stuff. This is a biological material. So that's why I can't go any further than that.
Okay, so if your hopes come true, and I think they're all our hopes as well, we do keep at that sort of level and supply continues, that gives us a figure of roughly 3.3 million vaccinations a week. And that means, by my primitive maths, if all goes well, all 9 at-risk groups of phase 1 will be vaccinated by the start of April. Is the start of April for all 9 at-risk groups a positive and hopeful target?
Well, I'm not going to put an exact figure on it. We're totally focused on getting the most vulnerable vaccinated by 15th of February and getting that offer to them by to have the jab by or on the 15th. We've then talked about getting the first 9 groups vaccinated by the spring, and then everybody vaccinated by September. So they're the 3 stakes in the ground, if you like. 15th of February, spring, and September. And we'll put more detail on that as and when we have more confidence in the supply chain.
You don't want to be quite as hopeful as I am this morning, then.
Well, I'm always full of hope and good cheer. Although that optimism as a characteristic has been tested by 2020, I can tell you.
Whoa.
But I'm also cautious. I don't want to make a commitment that I'm not confident of living up to.
Understood.
And the supply is, it is in the hands of the manufacturers who are
one
working
question.
so hard.
Here's one question on that. My final question. We know that Pfizer has some delays in their deliveries. AstraZeneca has said in the last couple of days that it's going to have to cut its deliveries to the EU by about 60% in the first quarter of the first 3 months because they've got production problems in their factory in Belgium. Is the UK going to get the same reduction in supply from AstraZeneca? Have they told you that too?
Well, AstraZeneca have made a public commitment to delivering 2 million doses a week to the UK. And that's they are. We were delighted to have that commitment. And that's what we're all working to. So I'm not expecting any changes to that. We're working very hard to make sure it's delivered. I mean, the good thing about the Oxford vaccine is that it is manufactured both here and on the continent. And then it's bottled, what they call fill and finish. It's bottled in the UK as well. And that process is going well. So there are challenges to supply, but so far so good on the Oxford AstraZeneca front.